All right,
Cool. All right, the floor is yours.
sure. Hi, everyone. My name is Vivek Nagar. I'm one of the chief residents at Montefiore. Give me a quick second here while I share my screen with you all. Okay. Okay. So here we go. Thank you, everyone, for joining us. Thank you, PM&R Scholars, for hosting. You know, this is a fantastic opportunity to showcase our program with all of you. And tonight we're going to do things a little bit differently. We think that it's very important as medical students to see and hear about our program from various perspectives, from all types of people who've been through our program. So tonight you're going to be hearing from our faculty, you'll be hearing from some of our junior residents, you'll be hearing from some of our senior residents and even residents who graduated from our program. Just to get some background, some perspective in terms of what it means to really be a resident at Montefiore and how that's going to help you on your journey to become the physiatrist that you all want to be. So I'd like to introduce Dr. Thomas. Dr. Mark Thomas.
Hi. So thank you all for your interest. I will keep my comments very brief because I'd really like to showcase the best part of the residency, and the best part of the residency is the resident body. It's the culture and the atmosphere the residents have created. We are also one of the oldest programs. We were initially accredited in 1946. We've graduated 74 classes of residents, the smallest number being 8 in a class, the largest number being 14. We currently have 27 residents, 9 per class. We have 3 ACGME fellowships in interventional pain, in pediatrics, and in sports medicine, and 2 unaccredited fellowships, the only women's PM&R fellowship in the country, and one of the few cardiac rehab fellowships in the country. Montefiore is one of the largest teaching hospitals. It's got 11 hospitals. It's got 186 practice locations through the Bronx and the lower Hudson Valley and extending its reach. And the health system includes Burke Rehabilitation Hospital, which has its own program, and White Plains Hospital. It's a very large training base, but our core is in the Bronx. The Bronx is the most ethnically and racially diverse area in the entire country, arguably in the world, and 56% of the households in the Bronx speak a language other than English at home. So the diversity of pathology, the diversity of the experience is impressive. What we look for are people who are the best match for what we can offer. There is no one program that is the best program for you. The best program for you is that program which aligns closest with your professional targets, with your goals, with your learning style, and with your sense of what you want from life. And right up front, I will tell you that our vision and mission, which drive our selection process as well as the program, have a real focus on service and on collegiality and collaborative learning and experience. And that's really an emphasis that permeates the entire course of the residency. We are most proud of the culture that the residents have built, and that's what we shepherd as a faculty most closely. We have 28 full-time physiatrists at home plus additional faculty, so there's a very favorable ratio. We have very good outcomes, a very comprehensive didactic and clinical curriculum, and you're more than welcome to ask about specifics, but I really encourage each of you looking for residency to be proactive in identifying the best fellowship for you. So I will keep the comments to that and turn it back over to Vivek.
Thank you, Dr. Thomas. Wise words as always. So we'll be moving on forward now with Dr. Devin Oaks. He's one of our PGY3s, newly minted PGY3s, and he'll talk about what life is like as a PGY2.
Okay, thanks, Vivek. That's a great picture of me, whoever found that. Thank you. So I was asked to come on and talk about life as a PGY2. So I'm a newly minted PGY3. So last year was a pretty exciting year. It's that first year after internship, you kind of get to bring together everything that you learned and apply it to a rehab setting. Whether that's kind of helping manage patients on the inpatient side with your medical knowledge, or helping out with procedures in clinic. So it's great to kind of bring that together and further your goals. For PGY2 year, a typical schedule has about, I guess, 6 months on average of inpatient time. We rotated 2 different hospitals, Montefiore Moses and Jacobi, both with very different, kind of like what Dr. Thomas said, very diverse, very different patient populations, which is fantastic because you have such a huge breadth of experience from that. So you take care of patients who are recovering from stroke, traumatic brain injury, patients who are new amputees, orthopedic patients, trauma patients, and even some burn patients too. So you get a lot of experience there. Now, the other time of the year, you're spending in outpatient, which is also a fantastic experience. So during that time, you kind of improve your MSK exam, and then also you get a lot of exposure to procedures. And not only that, but you actually do the procedures. So you get taught how to do joint injections, you work on trigger point injections, and from kind of the very beginning, the attendings are in there with you and they tell you exactly how to do it, they show you how to do it, and then you're the one who's doing it, which is just, I think, for me, a great way to learn. Along with that, we do have some specialty clinics as well that you participate in, 2 of them being spasticity and also pediatrics. I lump those together because in both of those clinics, you end up doing a lot of Botox injections to treat spasticity, whether it's patients who have had stroke and developed spasticity after that, or pediatric population, or sometimes the adult population who have cerebral palsy as well. So you are taught how to perform Botox injections under ultrasound guidance with an e-stim, with an attending right near you, showing exactly what to do. So again, it's this hands-on learning that really drives the point home. Other specialty clinics we do, prosthetics and orthotics clinic, where you learn about braces, which type of brace is needed in which type of situation. And then you do EMGs, and then after that, there's wellness clinic, which gets a little bit interesting with OMT, acupuncture, and if you don't know those things, then you get to learn about those things. And I'm told that's all my time, but it's been a great experience. I've had a great time.
Great.
See you later.
All right, thank you, Devin. Coming up next, we have Dr. Mariam Husseini. She is our resident expert in research and academia, PGY4. If I can have Mariam.
Hi, Vivek. Hi, everyone. Thanks
Hi.
for the introduction. For sure, not an expert, but I would be happy to share my experience with you all. Well, my name is Mariam. I'm going to talk about a little bit about research opportunities and National Society engagement, as well as conference attendance at Montefiore. And for that, I'm going to share my personal experience with you. As a PGY2, I discussed my interest with Dr. Thomas, listen, I'm really interested in research, and he mentored me, he guided me, he supported my research interest. And he really, as a PGY2, I didn't have any research track record at a time. And I would say the support is not just lip service. He connected me with the right people. He reviewed my manuscripts, multiple manuscripts, and he supported my application through Rehabilitation Scientist Training Program, which goes by RMSDP. It's a very tough program to get into. For sure, it is because of Dr. Thomas and Dr. Bartels, our chairman, support that I'm currently a fellow at RMSDP. There are numerous research opportunities provided to the residents to do research. It can be from writing case series to get involved in bigger projects. It really depends on your interest. We are very active in doing VR studies as well as Botox, and we do a lot of like research with 3D printing. In terms of conference attendance, really the attendance is encouraged, and it's not only participation, you know, it's encouraging you presenting posters. Our residents in the past, they presented oral presentations. They led workshop, which is amazing for someone being a resident leading a workshop in the past. I would say, lastly, but one of the most important thing about Montefiore is that they really support you and encourage you to be active in the national societies. They encourage you to be active in the society. You pick up leadership roles. For me, my interest wasn't research, so I'm currently a research representative at AAP in the Resident Fellow Council. And I would say really without program support, none of this would have happened. So for those of you who are here tonight, I would say if you have an interest in doing research, if you want to be active in conferences and national societies, for sure, Montefiore is a very good choice for you.
Awesome. Thank you so much, Mariam. Thank you for sharing your experience.
Sure.
All right. Coming up next, we will talk about fellowships with one of our own, Dr. Vinay Vinodia. He is a quote unquote PGY 5, and I think he'll explain why.
Hey guys, so I'm gonna talk a little bit about fellowships. Dr. Thomas, he mentioned some of the fellowships that we have, pain, sports, peds, women's, and cardiac. The cool thing about Montefiore is that our peds and our pain are PM&R run fellowships. You may or may not know, some fellowships can be run, like pain could be run by anesthesia, or neuro, and sports can be run by like family medicine and ortho. But our pain and peds and all of our fellowships that I mentioned are all PM&R run through our Montefiore PM&R department. And the advantage of that is that you get a lot of time, ample experience. You get a lot of time, spend time with the program directors, and you got to get a lot of experience for that. Also, we have electives that we do PGY 3 and 4 year, 2 months each. And even in those, you get to just really open your eyes and get the experience in these different fields that you may be interested in. Our pain is interventional, so you get to do a lot of interventional procedures. And like I said, you get to work directly with the program director. Sports, we do a lot of game coverage. We also do NYC Marathon and different things like that. And then we also have certain clinics that are run by our sports attendings, like ultrasound clinic, things like that, which is really nice. You get a lot of experience in whatever you're interested in. Some of the best things about Montefiore that you may have heard of is a camaraderie that we have at our program, the really friendly and family atmosphere. And a lot of that comes down from our program director, Dr. Thomas. He really genuinely cares for the residents and really wants to see the best for everybody. And because of that, he really helps you kind of figure out your 3 years of residency and how to best reach your goal. And I'm talking from experience. I'm currently a fellow at UT Baylor in, basically it's a traumatic rehab medicine fellowship with a focus on polytrauma and amputee care. And for me, he helped me really kind of guide me through my 3 years to get enough experience in prosthetics and orthotics, spending a lot of time in amputee care, and really was a big part of me matching where I wanted to match. I could also speak about my co-chief when I was chief last year, who matched at JFK for TBI. My other classmates, one of them matched at pain into Montefiore, another one in pediatrics at Montefiore, and someone else in women's rehab at Montefiore. So these are really great opportunities. And like I said, everyone's super friendly. You get to learn a lot, and you get to just really experience what you want to.
Thanks so much, Vinay. Appreciate it. Thank you for coming back and joining us now that you're in that fellowship life. So moving on to Dr. Cecilia Cordova. She's one of our star PGY3 residents, and she's going to talk to you guys about some community outreach that we do, both locally, nationally, and internationally.
Hi, thank you, Renee. Thank you, Renee, for joining us, and thank you, Vivek, for the presentation. As everyone has seen so far, Montefiore mission is focused on the community we serve, which is pretty unique and underserved. So the Bronx, that's our heart. And our rehabilitation department, with its own patient-centered and holistic approach, has developed different initiatives to help our community. We work in an interdisciplinary team that is very focused on the social work connections, and we go far and beyond that. One of the biggest things we do is the wellness clinic that Devin mentioned a little bit before, with some OMM and acupuncture that it's led by the residents' experience and knowledge, and also by our attendings. Sorry, the lights. But all the residents get to be active. We get some counsel in diet, nutrition, lifestyles, and also meditation for those patients that otherwise they wouldn't have any access to it. We also have an adaptive sports events that we do every first Saturday of the month. It's basically driven by PM&R residents and medical students from Einstein Medical School, but also supported by our sports medicine fellowship, by the attendings and by their fellows. We gather in the park that it's nearby our hospital, so it's pretty close for our community, and we do different activities that are adaptive for everyone with different functional levels. And one of the things that Vivek mentioned is that we don't just stay here in the Bronx, but we also serve communities that are very underserved, very isolated, that don't have quick access or access throughout the year to rehab. And those are our mission trips that are either led by Montefiore or by our attendings. We have had mission trips to Jamaica, to El Salvador, and also to Israel. There we don't only do rehab, we do have like rehab clinics, we help a lot with procedures, but we also go back to the basics of our medical knowledge, and we teach a lot and we educate a lot, not just the patients, but also the community, the health community that allow us to be part of them for that period of time. Overall, our program is very open to the residents' ideas in order to help us get involved in the community. We serve in different levels, as I mentioned, like in clinic, also during the weekends, and even internationally. So these are just a few successful examples that we can share, but also we're just starting an amputee coalition that was started by Vinay, and we're gonna continue working on that.
Hey, Cecilia, about 3 minutes left, okay?
Awesome. Okay, thank you, Cecilia. I'll introduce Kishan Sitapara, one of our co-chiefs, and Barry Madureira as well, one of our co-chiefs. I don't know if we have time now for some questions, if there's anything in the chat.
Yeah, about 3 minutes. Rather.
Hey guys, my name's Kishan. I'm one of the chiefs, like Vivek said. I know we didn't hit on things that, you know, people have talked about before, like rotation schedule, call schedule, all of that. We are super happy to share it with you over email. If you guys have any questions, we'll share our email addresses and all of that. We just thought it'd be a good experience to kind of hear from residents, firsthand experience, and our program director. But if you have any of those logistic questions, we are of course more than happy to talk to you about them and share them with you. Feel free to email us after this at any point. And we'll be checking the chat tonight. So if you have any questions, feel free to post on the chat.
Right. And no resident or fellow was paid for this promotion. We'll end on that.
Awesome. I really enjoyed the collegiality and personality of your presentation. It was very nice. As you guys can see here, there's their contact information, so feel free to send them as many questions as you guys can. As I said, they're not getting paid for this, but you guys have like about another minute if there's any final things you guys, you know, would like to say before we move on to the next and final program.
Yeah, you know, just touching back on what Dr. Thomas said, you know, it's really important to find the program that's going to fit well for you. You know, you'll hear a lot of generic things, but I hope that at least with this type of presentation, you know, you can see that we really are a family here. Even when you graduate, people like Vinay, they come back. We pay it forward to our incoming residents and moving out afterwards. So you have a very strong family here at Montefiore that'll follow you past your residency throughout your career, and I think that's a really important thing. Sorry, Dr. Thomas just had I had Dr. Thomas in my mind, so had to share that. I guess we'll end on that.
Seems like a pretty solid way to end it. So thanks again, Montefiore. If anyone has any program questions or, you know, just general questions, their contact information is on the screen. We'll make sure to get this to everybody as well. Again, thanks, Montefiore.